Hi, my name is Valentina Nicolina, and I am a faculty member here at Queens College. I am also a licensed clinical psychologist, and I'm here to tell you a little bit about the clinical psychology cluster courses at Queens College and what you can expect if you take those courses and make clinical psychology as your psychology undergraduate specialization at Queens College. What is clinical psychology? Clinical psychology is the psychological specialty that provides continuing and comprehensive mental and behavioral health care for individuals and families, consultation to agencies and communities, training, education, and supervision, and research-based practice. It is a specialty in breadth, one that is broadly inclusive of severe psychopathology and marked by comprehensive integration of knowledge and skill from a broad array of disciplines within and outside of psychology proper. The scope of clinical psychology encompasses all ages, multiple diversities, and varied systems. So this is a quote from the American Psychological Association, and that's how they define clinical psychology. But what does this really mean? Clinical psychology is a widely applicable discipline where you can expect to work with individuals across the lifespan, so really young kids and older adults and everyone in between, and provide talk therapy and assessment, which means to assess individuals' difficulties, to those who might be experiencing problems in living or different kinds of mental disorders. Clinical psychologists also provide a variety of other kinds of services in their careers, including teaching, mentoring, supervising up-and-coming psychologists, providing consultation to other disciplines, such as doctors and hospitals. Clinical psychologists also pay a lot of attention to the diversity that encompasses the human race, and we are very much aware of the impact of different cultures, races, ethnicities, gender identities, sexual orientations, and so on to the way that individuals develop and how they do in their life. So a little bit more about what clinical psychologists do. Number one skill that individuals think of when they think of clinical psychology is talk therapy. And that is when someone who develops a particular issue comes to a therapist, and through talking to the therapist, they find a solution or improve their way of life. And that is definitely within the domain and the scope of clinical psychology, and a lot of clinical psychologists focus on that kind of work. Clinical psychologists also do assessment, and assessment is actually something that is unique to clinical psychology. No other discipline has an overlap with clinical psychology when it comes to assessment, and specifically a unique kind of assessment called neuropsychological assessment. And that is a type of assessment that looks at how individuals perform in certain tasks and correlates it with how their brain is functioning. The goal of this kind of assessment is to understand whether something has happened to an individual to impact on their cognitive functioning, to identify strengths and weaknesses, and to determine how disease might have impacted on someone's brain development or brain functioning and their prognosis. There is a wide range of applications when it comes to assessment. And again, it is something that is uniquely within the domain of psychologists and not shared with other disciplines that provide similar kinds of services as psychologists do. Consultation is something that clinical psychologists do as well. They consult with other professionals. For example, if you are a school psychologist or a clinical psychologist working in a school, you might be consulting with educational individuals to help them understand how to better manage someone's difficulties, a child's difficulties in the classroom. You might also be a psychologist in a medical setting and consulting with physicians on different issues to improve the care of their patients. Clinical psychology is a discipline that's based in science, and some psychologists do research. So they dedicate their time to systematically studying the brain, psychological disorders, the impact of different cultures on disorders, and a range of many, many different research questions. They also study how to better help individuals and which treatments work better than others through research. And finally, clinical psychologists do teaching and training. They teach in colleges and in doctoral programs, and a lot of clinical psychologists teach through practice by providing clinical supervision to new psychologists who are just going through their graduate level training. Where do clinical psychologists work? Well, in a lot of different places. Hospitals, schools, colleges, government agencies, private companies all come to mind. So there are a lot of different applications to a clinical psychology degree and a lot of different places where clinical psychologists may find employment. To become a clinical psychologist, you need a license to practice psychology. In order to obtain that license, you need a doctoral degree, which is a PhD or a PsyD. And to get a doctoral degree, you need to have gone through a doctoral program. Doctoral programs typically last 5 to 6 years and include a rigorous curriculum, lots of practicum to learn how to apply psychological treatments, and also a competitive clinical internship, which is a year-long practicum component. Graduate school applications are competitive, comparable in their competitiveness to medical school applications. So in order to be prepared for the graduate school application process, it is advised that undergraduate students start early in their undergraduate career to think about how to apply to doctoral programs, get a good GPA, gain some clinical experience and some research experience. Some individuals find it more helpful to get a master's degree before going on to their doctoral training. That is another alternative path. However, if you take the clinical psychology cluster courses here at Queens College, you will not only be prepared for applying to doctoral programs or master's programs in clinical psychology, you might also find this to be a good basis for applying to programs in social work, mental health counseling, school psychology, counseling psychology, among others. All these professions that I've listed here require advanced degrees. So if you are interested in applying to any of these or to clinical psychology, you need to prepare early in order to be a competitive applicant.